The question I get asked the most is, what are normal periods? It can be quite difficult to answer because periods change from woman to woman, or they change within the same woman month on month. Normal is a period that is manageable. So if your periods are impacting on your life, preventing you from doing things that you want to do, or perhaps more importantly, things that you need to do, like go to work, go to school, if they're stopping you doing that, then that would be considered problematic, and women should seek help if they're in that situation. Many people who menstruate do experience pain or discomfort during a period. Usually that is because the muscle layer of the womb is contracting, and that helps the womb get rid of the blood, the lining of the womb, and that comes out through the vagina and leaves the body. So it's part of the natural process of a period for those contractions to take place. But particularly at the start of having periods, so when people are teenagers and just starting to get periods, those contractions can be a little bit uncoordinated and can be more painful. People may need to use over-the-counter medications, paracetamol, ibuprofen. Some people find a hot water bottle or a hot bath can be quite helpful. And often over time the pain will ease. But if those sort of measures aren't working, then that is something that you should see your doctor about. The hormones do change across the menstrual cycle. In the first half of the cycle there's a huge amount of estrogen. In the second half of the cycle, after the egg's been released, there's lots of progesterone. So as those hormones go up and down across the cycle, people can notice different effects. Estrogen normally is quite a positive hormone. People notice their skin's good, their hair's good, they feel perhaps a little more attractive. And then when progesterone kicks in, some of the less good symptoms can occur. It can affect your mood, it can make your hair and skin a bit more greasy, a bit more spotty. Breast tenderness can happen when progesterone levels rise. And then right before a period, those hormone levels come crashing down, and that's the signal for a period to start. So those big changes between high and low levels can really impact on mood and other factors. So it's something that some people are very aware of and notice a great deal throughout the cycle. Other people are much less aware of those hormone changes, so again that can vary from person to person. Usually a period would last less than 8 days is the typical duration of a period. Over 8 days would be considered a prolonged period. Typically women would lose about 40 mils of blood. Those sort of measurements are not so helpful for women. So what's more useful often is the sort of management of periods. So I see people with very heavy periods, and often they'll say they flood through their menstrual products, and that really is indicative of very heavy periods. The other thing that can be associated with very heavy periods are blood clots, and often that's associated with increased pain as well. So those would be good indicators that your periods are heavier than most. And the worry with that is that it can cause problems with anemia and low blood count, but also stops you from doing the things that you need to do. So women who are scared to leave the house when they're having their periods, that's usually because they're suffering from very, very heavy bleeding. If you're experiencing any of those kind of symptoms, it's best to speak to your GP or your doctor about that. It's important to find the underlying cause of the heavy periods and get an appropriate treatment, and your GP can advise you about that. Other sort of symptoms that could signify something serious that would need to be excluded would be bleeding in between periods, bleeding after sex, or any bleeding that occurs after you've been through the menopause. Those would be symptoms that would definitely need to get checked just to exclude any serious causes. It's really useful if you have some dates and times to hand and have a bit of a think about things beforehand. Things that we would be asking you about is the first day of your last period, and then we like to know how many days you would typically bleed for during a period, and the number of days from the first day of one period to the first day of the next period. And that may be the shortest time and the longest time between those two. The other date that is useful to have a rough idea of is when your last smear test was. That can be very helpful. And all of that information then is processed very quickly by your doctor to try and work out what the problem is that you're experiencing and direct the treatment appropriately. a young person who's just starting to have periods, or at that age, it can be a bit of a scary time, but it's something that's very natural. It's a process that many people go through. There's nothing shameful about periods, and I would encourage people to have very frank and open conversations, including in the home with parents, to talk to boys and girls about periods and what that involves, so that people can identify what's problematic and what's typical, and have more of awareness of their own bodies. And it's really important, I think, that young people speak to their friends and peers about periods, take some of the stigma out of it. It just allows people to identify when there's a problem and make it easier for them to seek help if that's the case.